Hi everyone, welcome back to my channel. Please subscribe, follow, like, and comment. So today I'm going to be discussing the effect of Postinor-2 on the menstrual cycle. The significant side effect of Postinor-2 on the menstrual cycle are changes in the duration of the period, heavier menstrual flow, or an irregular cycle pattern. However, the birth control pill can have other minor effects depending on when and how you take it after sex. Menstrual cycle disturbance is one of the most common side effects of birth control pills like Postinor-2. If you had unprotected sex and took Postinor-2 as soon as possible, you may notice some irregularities in your period, such as an early or heavy menstrual flow. Unexpected changes in your period can be scary, but you are not alone. Many women complain about this too. One of the possible reasons behind these changes is the usual side effect of emergency contraception. In the rest of this video, you will learn how the use of Postinor-2 can affect your menstruation, the changes to look out for, and when to know it's time to see the doctor. Understanding Postinor-2 and the menstrual cycle. As you already know, Postinor-2 is an emergency contraceptive. It is to be used within 72 hours after sex to prevent emergency when you didn't use any form of pregnancy prevention techniques before having sex. Many people call it the morning after pill. The morning after pill. While the World Health Organization says Postinor-2 is safe for preventing pregnancy, it's not meant to be taken regularly. The medication is meant to serve as an emergency for those occasions when you forgot to use a condom or are not confident in the efficacy of another form of contraceptive you are using. So if you take the pill, how does it affect your menstrual cycle? Now, a woman's menstrual cycle generally has a mean interval of 28 days between the two menses. Now, while most side effects of Postinor-2 on menstruation are temporary, there are situations where prompt consultation with a healthcare professional is necessary. For instance, if you are experiencing severe or persistent symptoms like heavy bleeding, intense cramps, breast tenderness, or persistent nausea after taking Postinor-2, you can talk to me and I will respond to you immediately. Now, I need you to take this away with you. I need you to take this away with you. Morning after pills such as Postinor-2 prevent pregnancy after unprotected sex by halting or delaying ovulation. It's common for women to experience an abnormal period after taking the Postinor-2 pill. However, the extent of this effect depends on the timing of pill consumption within the menstrual cycle. So, not everyone will experience irregularities. However, it can also influence the duration of your irregular menstrual cycle, leading to potential changes. Now, I will be telling you some possible changes you might encounter with your next period after taking Postinor-2. Now, number one, it may occur a few days to a week earlier or later than usual. Two, it could be heavier or lighter than your typical flow. Three, the duration of your period may be longer than usual. Another one is you might experience more or less pain during your period. See, these symptoms may cause concern, but your menstrual cycle should return to its regular pattern by following processes. However, if more than a week passes without your expected period, I recommend you take a pregnancy test to confirm the effectiveness of the Postinor-2. Remember, the morning after pill is a reliable form of emergency contraception, but it's not intended to replace regular birth control method at all. If you have any questions or concerns, consult with a healthcare professional who can provide personalized guidance. Or you can as well drop your questions in my DM and I will reply you immediately. Now, there are some certain facts I want to tell you about Postinor-2 on your womb. The effect of Postinor-2 on the womb. Postinor-2 contains what we call levonorgestrel, which can cause temporary changes in the womb lining, making it less receptive to fertilized egg. However, these effects are reversible and do not have long-term consequences. What are the side effects of Postinor-2 after a week? Now, after taking Postinor-2, Some common side effects that may occur within a week include nausea, vomiting, abdominal pain, fatigue, headache, breast tenderness, changes in menstrual bleeding, and dizziness. These side effects are usually temporary and resolve on their own. What is this effect of taking Postinor-2 tablets at once? Effect of taking Postinor-2 tablet at once. As directed, taking Postinor-2 tablet at once is the recommended dosage for emergency contraception. It contains a higher dose of levonorgestrel and is designed to be taken as a single dose. Taking both tablets together helps ensure the effectiveness of the medication in preventing pregnancy. Now, what happens if you use too much Postinor-2? What happens if you use too much Postinor-2? Using too much Postinor-2 can increase the risk of experiencing side effects. Taking more than the recommended dose does not enhance its effectiveness in preventing pregnancy. Still, it may lead to more severe symptoms such as nausea, vomiting, hormonal imbalances, regular menstrual bleeding, and other temporary hormonal disturbances. For your health's sake, follow recommended dosage instructions. I've come to the end of this video, my lovely people. Please subscribe, like, share, and follow. I'll be expecting your questions my comment section, or you can DM me as you like. I'll see you in my next video. Thank you.